Welcome to the deep dive. We're all about, well, cutting through the noise, aren't we?
Yeah.
Getting to the core insights you need to stay right at the forefront of orthopedic practice. It's such a dynamic field, always evolving. New research, shifting techniques for mid-senior professionals, keeping up, truly staying at that cutting edge. It can feel like a constant challenge, and that's really why we're here today. Our mission is to give you a bit of a strategic shortcut. We've done a deep dive into some really comprehensive discussions around orthopedic rehabilitation, examination, and intervention. We've tried to meticulously pull out the crucial insights, distill that complex information into knowledge you can actually use in your practice. And joining me today to help us unpack all this is Professor Mo Imam. Your extensive background, clinical practice, that renowned analytical perspective, just invaluable as we navigate this.
Oh, it's a real pleasure to be here, this area. It's just so vital, isn't it? We're constantly synthesizing new information directly impacts patient care. I'm very keen to explore these critical aspects with you.
Excellent. Okay, so let's unpack this. Today we're diving deep into the foundational elements, the things that really define excellence in modern orthopedic care. We'll start by exploring the sort of evolving landscape of orthopedic rehabilitation. Then we'll move into mastering examination and diagnosis, and finally look at evidence-based testing for, real precision in practice. So rehabilitation first. A central point that really jumps out is this direct link, this correlation between the quality of post-op rehab and how effective the surgery actually is. For you, what does that profound correlation truly mean for patient outcomes? In the real world, I mean. It sounds obvious, perhaps, but the implications seem quite far-reaching.
You're quite right. On the surface, yes, it might seem obvious, but that statement holds a really profound truth in orthopedics, one that's perhaps often underappreciated in its full depth. It essentially means the surgical fix, no matter how brilliant, how technically precise it is, well, it's often just the starting point, not the end of the patient's recovery journey. Think of it like this. A surgeon can meticulously repair, say, a torn ACL, restore that anatomical integrity, fantastic. But without a really well-planned, high-quality rehab program, one that addresses strength, proprioception, neuromuscular control, even psychological readiness, well, that patient might never fully get back their pre-injury function, or worse, they might face re-injury down the line.
Right. The surgery itself isn't the whole story.
Exactly. High-quality rehab isn't just an add-on after surgery. It's indispensable, a non-negotiable component for maximizing that return to function. Whether we're talking common sports injuries or, complex post-surgical conditions, if you, as the clinician, think about your patient achieving their goals, whether it's elite sport, an active job, or just walking without pain, it all hinges on this continuum of care. This foundational principle, it really underlines that orthopedic care is a true partnership. It's the surgeon's skill and the rehabilitation specialist's expertise. Ultimately, the rehab often dictates the true functional outcome, which of course impacts the patient's quality of life, their long-term success. It's about restoring not just the structure, but the whole functional capacity. And confidence, too. That's key.
That really drives home the importance, doesn't it, is optimizing that whole recovery journey. And building on that, there's a strong point made about needing a truly integrated team approach in rehabilitation. It's mentioned that every section is written by a combination of surgeons, physical therapists, and occupational therapists. Beyond the sort of obvious benefits of collaboration, what's the transformative potential here? What can this multidisciplinary approach really achieve in practice? And perhaps what hidden challenges might it proactively solve for the patient?
The integrated team approach. Yes, that's where the synergy really unlocks, I think, superior outcomes in modern orthopedics. While, the general benefits of teamwork are well known, this specific mix, surgeons, physios, OTs contributing collectively, it points to a deeper level of foresight. Each professional brings a unique, yet really complementary perspective. The surgeon gives crucial insights into the repair itself, the biology, the healing constraints, maybe things they saw intraoperatively that influence the protocols.
Things the rehab team might not otherwise know.
Precisely. Then the physical therapist brings their expertise in restoring movement, strength, function, using targeted exercises, manual techniques. And the occupational therapists, they focus on that functional reintegration. Activities of daily living, work needs, adaptive strategies, all critical for getting the patient smoothly back into their everyday life. What's particularly insightful, I feel, is how this collective expertise isn't just about sort of sharing notes. It's about building a unified plan, a shared mental model for that patient's recovery. This proactive collaboration minimizes potential bumps in the road, misalignments between surgical goals and rehab milestones, for instance.
Can you give an example of that?
Sure. A surgeon might explain a specific fixation technique they use requires a very careful, slow initial weight-bearing phase. The physio can then directly embed that into their early protocol, avoiding any unintended stress on the repair. Or, conversely, an OT might spot a specific barrier in the patient's home environment, maybe difficult stairs. That prompts a joint discussion about adaptive kit or modified exercises, perhaps earlier than usual.
So it smooths out potential friction points.
Exactly. This integrated model is invaluable for that appropriate initial exam, for robust interventional diagnosis, for tailoring treatment, and for delivering truly holistic rehabilitation. By anticipating and managing those inevitable sticking points in complex cases, maybe differing priorities or timelines, the team ensures seamless care transitions, minimizes gaps, builds patient trust. This shared understanding, it leads to more comprehensive, more resilient patient management plans for you. It ensures every aspect, from cellular healing right through to psychosocial reintegration, is considered and supported.
That sounds incredibly thorough, ensuring nothing gets missed, even anticipating problems. Now let's shift to methodology within rehab. A critical element highlighted is that treatment and rehab protocols are presented algorithmically step by step, and each new phase only starts after specific criteria are met. This criteria-based progression, it's stated as reflecting current best practice. Why is this approach seen as superior, especially compared to the older, more rigid time-based protocols? What are the real advantages for clinicians and for patients?
Ugh. This is a crucial distinction. It really signifies a fundamental shift, a real evolution in rehabilitation philosophy. Historically, yes, many protocols were time-based, at 6 weeks post-op, start active range of motion, that sort of thing. The inherent weakness with time-based protocols is they just fail to account for individual patient variability. It's a massive flaw, really. Biological healing rates are unique. Responses to therapy differ hugely. Unexpected complications can crop up.
So a one-size-fits-all timeline doesn't work.
Not effectively, no. A rigid, time-based approach carries significant risk. You might push a patient too hard before their tissues are ready, leading to setbacks, even re-injury. Or, conversely, you might hold them back unnecessarily, which prolongs recovery, leads to deconditioning, perhaps even psychological frustration for the patient.
Which nobody wants.
Quite. Criteria-based progression, on the other hand, it's dynamic. It's highly individualized. And it's inherently patient-centered. Each new rehabilitation phase only begins when specific, measurable criteria, functional or physiological, have been objectively met. For instance, moving to a certain weight-bearing exercise might only happen once a patient consistently shows a specific pain-free range of motion, or a measurable strength level against resistance, or demonstrates good neuromuscular control during a functional task.
So it's tailored to their actual progress.
Precisely. This flexible yet structured framework empowers you, the clinician, to tailor rehab exactly to that individual's recovery milestones. It inherently ensures safety because it respects the biological healing process. It maximizes functional gains by advancing therapy only when the body is genuinely ready. And it optimizes efficiency by preventing stagnation. It's about listening to the patient's body, listening to objective measures, not just blindly following a calendar. This leads to safer, more effective, and ultimately far more successful long-term outcomes, because you're adapting the pace to their unique biological and functional progress.
It really sounds like precision care, doesn't it? Tailoring it right down to the individual. And speaking of evolving, there's a strong emphasis on extensive updates, including new evidence-based literature, plus entirely new chapters on specific conditions. Did you perhaps detail some of these newly covered conditions? And more importantly, what is their inclusion signal about the field's continuous advancement? Is there a shift in focus, perhaps?
Yes, what's truly fascinating here is how including these new conditions and the extensive updates really mirrors the ongoing expansion of our orthopedic understanding and the focus on increasingly nuanced challenges. Take, for instance, the new chapter on medial patellofemoral ligament, MPFL reconstruction. It's not just covering another injury, it highlights a critical advance in understanding patellofemoral instability. MPFL tears often need meticulous surgical repair, and the material delves into how advances in things like graft choice and tunnel placement now demand extremely precise phase-specific load management and rehab. This is vital to prevent graft laxity or early failure. This technical nuance directly shapes the criteria for progression, far beyond just general knee rehab protocols.
Right, so the rehab has to match the surgical advance.
Exactly. Similarly, adding pec major ruptures signifies a growing recognition of this injury, which can be quite debilitating, especially in athletes. Rehab there needs a careful balance to restore significant power without risking a re-tear. Thoracic outlet syndrome is another key addition. It shows how orthopedic care is increasingly integrating with neurovascular factors, needing a multi-system approach to diagnosis and treatment. And the expansion into things like athletic pubalgia and hip labral repair and reconstruction reflects that exponential growth in understanding complex hip pain. It demands highly specialized joint-specific rehab protocols that preserve the joint while restoring function, particularly for athletes.
So it's getting much more specialized and granular.
It is. For you, the clinician, this signals that orthopedic practice is constantly pushing beyond the traditional big joints and common injuries. It's about keeping pace with new surgical techniques, addressing previously untreatable conditions, better diagnostics, pinpointing subtle issues, and a deeper understanding of regional biomechanics. This continuous integration ensures rehab protocols aren't just current, but genuinely cutting-edge and evidence-based. It directly serves your need to provide the most advanced, effective care possible. It's really a testament to the field's relentless pursuit of better solutions for patients.
That's incredibly reassuring for professionals trying to stay current. It gives a real sense of the technical frontier. And on the practical side, reviewers have called this material an invaluable resource and even the Bible of rehabilitation in orthopedic surgery. Pretty strong endorsements. How do these connect to the format? Specifically things like easy-to-follow videos and new full-color images. How do features like that cater directly to busy medical professionals, keeping them in step without overwhelming them?
Those enthusiastic endorsements, yes, particularly being called the Bible, they speak volumes about its profound utility, and they absolutely connect directly to the format. Because for you, a busy clinician, time isn't just precious, it's a critical constraint. Having easy-to-follow videos and clear, full-color images isn't just about aesthetics. It's about transforming complex information into immediately digestible, applicable knowledge for the clinic floor.
Making it quick to grasp.
Exactly. Picture this. Busy clinic. Patient presents with a less common post-op condition. You need a quick refresher on a specific procedure or need to clearly explain a nuanced exercise to them. Instead of wading through dense paragraphs of text, you can glance at a high-quality image or watch a short, concise video demonstrating that movement or manual therapy technique. This visual learning, this practical presentation, it streamlines acquiring, verifying, and applying knowledge. It caters directly to that dynamic, on-your-feet nature of clinical practice. It lets you quickly grasp concepts, confirm techniques, even educate patients effectively on their home exercise programs. This immediate usability is what makes it invaluable. It's not just theory, it's practical, actionable guidance presented in a way that genuinely supports and integrates into your daily workflow. It keeps you very much in step with ongoing changes without adding to your already heavy workload. It significantly cuts down cognitive load and boosts recall.
Absolutely. Time is key, clarity is paramount. Okay, let's pivot now to our second pillar, mastering orthopedic examination and diagnosis. This area is described as a complete, evidence-based guide to evaluation and treatment, again, distinguished by its multidisciplinary approach. Could you elaborate on this comprehensive scope? It weaves together anatomy, kinesiology, biomechanics, with, as it says, a healthy dose of pathology. How does that integrated understanding really help clinicians achieve more precise, more effective diagnoses?
Well, this comprehensive approach is, quite simply, foundational. It's the bedrock for achieving truly precise diagnosis in orthopedics. It's about moving beyond just identifying symptoms to deeply understanding the underlying mechanisms of injury and dysfunction within the musculoskeletal system. When you properly integrate anatomy, kinesiology, and biomechanics, you're building a complete dynamic picture. How the body's structured, how it moves, the complex forces acting upon it. Anatomy gives you the specific bones, muscles, ligaments, nerves. Kinesiology provides the how, the movements, muscle actions, joint mechanics, and crucially, biomechanics provides the why, the forces, the stresses, the loading patterns that either maintain health or contribute to injury or pathology.
So it's structure, movement, and forces combined.
Exactly. Then adding that healthy dose of pathology lets you connect these fundamental principles directly to actual disease processes and injuries. So you're not just observing, say, limited shoulder movement, you're understanding why it's limited. Is it a structural block like an osteophyte? Muscle weakness or spasm, nerve impingement affecting motor control, altered joint mechanics from chronic instability. This integrated understanding allows you, the clinician, to develop a really robust, nuanced differential diagnosis. It means you can systematically rule conditions in or out, considering not just local symptoms, but broader movement patterns, compensatory strategies, potential systemic factors. For you, it fosters a profound depth of diagnostic accuracy, which leads directly to more targeted, efficient, and ultimately more effective interventions. symptoms. It prevents that narrow symptom-focused thinking and promotes a truly holistic mechanism-based view of the patient's problem, essential for complex cases.
That's a really powerful combination. It sounds like it fosters an incredibly deep understanding, well beyond just surface assessment.
Yeah.
Now, a unique aspect noted is the consistent, unified voice of a single author described as a prominent practicing therapist. In a field as intricate, as sprawling as orthopedics, what are the specific benefits of having that single, consistent voice throughout? Does it genuinely enhance clarity? Are there other subtle advantages?
Yes, in a field like orthopedics, which is so intricate, so multifaceted, where terminology can vary, diagnostic approaches might differ between practitioners, that consistent, unified voice of a single author offers a huge, perhaps understated advantage. When you're learning about or referencing examination techniques, diagnostic pathways, having consistency in language and methodology in the underlying clinical philosophy, it greatly enhances clarity, and it significantly reduces your cognitive load. You're not forced to constantly adapt to different writing styles or try to reconcile potentially conflicting viewpoints or decipher varying terms from multiple contributors within the same resource.
Which can be quite confusing.
It can be very confusing. This singular voice provides a coherent, unbroken narrative. It offers clear, step-by-step guidance on examining each joint and region. It ensures the specific terms for texts, anatomical landmarks, pathological signs remain uniform from chapter to chapter. For you, this structured approach helps prevent information overload, a common challenge in dense medical texts. It creates a cohesive, progressive learning experience, makes it much easier to build a systematic, reliable understanding of orthopedic examination. This means you can apply that knowledge confidently and consistently in your daily practice without that mental friction of switching between different interpretive frameworks. It builds a consistent mental model, which is incredibly valuable for rapid, accurate clinical reasoning.
That consistency does sound invaluable. For clarity, for really embedding the learning. Building on that, another practical strength highlighted is how this approach guides clinicians logically through systems review and differential diagnoses, helped by decision-making algorithms for each joint. Could you elaborate on the practical application, the tangible benefits of these algorithms? How do they specifically sharpen diagnostic precision when clinicians are facing complex cases?
The inclusion of these decision-making algorithms for each joint, it's a really significant practical benefit. They act as a highly efficient, structured roadmap through the diagnostic process. In orthopedics, as you know, a patient's symptoms can often point to several possible conditions. Differentiating between them can be profoundly challenging, especially when presentations overlap or mimic each other.
That's a common frustration.
Indeed. These algorithms provide a systematic, logical way to navigate that complexity. They guide you through a precise sequence of clinical questions, targeted physical tests, symptom analysis, helping you systematically narrow down the possibilities. For instance, an algorithm for shoulder pain might first prompt you to check for red flags, then differentiate rotator cuff issues from labral tears, then guide you to specific tests to rule in or out nerve entrapment versus intrinsic joint pathology. Crucially, they integrate findings from both the musculoskeletal and nervous systems, ensuring that holistic diagnostic approach we talked about. The benefit for you, the clinician, is immense. They help you avoid overlooking critical differential diagnoses. They ensure a thorough yet remarkably efficient examination, and ultimately they help you arrive at a more accurate diagnosis with significantly greater confidence. It's about providing a clear, logical, evidence-informed framework for clinical reasoning, which is truly essential for effective and efficient patient management, especially when time is tight.
So, sharpening diagnostic precision and efficiency, key in a busy clinic. And on that note, a particularly strong point made is its ability to strike a nice balance between detailing examination and treatment. Unlike other resources that often focus heavily on just one or the other. If we connect this to the bigger picture of patient care, what's the real significance of integrating these two aspects? How does it streamline clinical decision-making and foster that more holistic approach?
Connecting this to the bigger picture. The profound significance of integrating examination and treatment within one cohesive framework is that it perfectly mirrors the natural, iterative flow of clinical practice itself. In reality, diagnosis and intervention are never truly isolated steps, are they? They're intrinsically linked. They constantly inform one another. A truly comprehensive examination doesn't just identify a problem. It should directly inform the very first steps of treatment. And conversely, a patient's response to that initial treatment often provides further diagnostic clues or helps refine the existing diagnosis.
It's a feedback loop.
It's exactly a continuous feedback loop. So, when you have a resource that balances both detailed examination techniques and evidence-based treatment protocols, it fundamentally streamlines your clinical decision-making. You're not having to constantly jump between multiple texts or mentally bridge disparate bits of information to connect your diagnostic findings with appropriate therapeutic strategies. This integration fosters a far more holistic, patient-centered approach to management. It ensures the diagnostic process directly informs and shapes the therapeutic strategy, leading to more targeted, efficient, and ultimately more effective interventions. For you, the clinician, this translates into a more seamless workflow, a more coherent understanding of the patient's entire journey from injury to full recovery, and a more effective, comprehensive approach to restoring function and relieving pain. It powerfully reinforces the idea that examination isn't an end in itself, but a vital means to guide effective, individualized treatment.
That makes the workflow so much smoother, and the clinical reasoning more robust, doesn't it? Finally, for this section, the practical utility is consistently reinforced. Reviews call it very accessible, categorized in a straightforward manner, and a great reference to have in your library. How do these attributes, maybe combined with features like clinical pearls and highlighted boxes, make the material immediately useful in a demanding clinical environment? It seems really designed for speed and relevance.
Those attributes, accessibility, straightforward categorization, and those invaluable clinical pearls, they are precisely what elevate this material into an indispensable tool for that demanding clinical environment. You, as a clinician, you're often working under immense time pressure, needing to make rapid, informed decisions, sometimes with limited data. A text that's very accessible and categorized straightforwardly means you can quickly find the exact information you need without wasting precious minutes. It's designed for efficiency. Information retrieval is key.
Getting straight to the point.
Exactly. And the clinical pearls in highlighted boxes. They're particularly ingenious, I think, and immensely valuable. These are often concise, high-yield insights, practical tips, subtle diagnostic cues distilled from years of collective experience. They might summarize complex concepts, highlight common pitfalls, or offer nuanced clinical wisdom in easily digestible nuggets. For a busy professional, these pearls can be invaluable. Confirming a suspicion, remembering a key differential that might otherwise slip your mind, refining a technique right there at the point of care. They serve as immediate, actionable insights that can be directly applied to a patient presentation, potentially guiding your next step in examination or intervention. In essence, these features transform the material from just a textbook into an immediate, readily available, highly practical toolkit for daily problem solving, enhancing both the efficiency and the quality of care you can deliver. They're quick wins for clinical effectiveness.
That's a truly compelling case for its practical, almost on-demand value. Fantastic. Right, let's pivot now to our third foundational pillar, evidence-based testing. Focusing on precision in practice. What's highlighted here sounds quite innovative. It's described as the first resource to truly demonstrate benefit by using a test and measure for screening or diagnostic confirmation based on rigorous criteria. Could you unpack these rigorous standards? How do requirements like appropriate diagnostic accuracy, being free from bias, and being reproducible and effective for the condition and clinical environment fundamentally change how you approach special tests in daily practice?
Yes, this aspect is genuinely groundbreaking. It represents a significant paradigm shift, I believe, in evidence-based practice for orthopedics. Traditionally, many special tests were taught and used based on, well, historical convention, perhaps expert opinion, sometimes anecdotal evidence, often without rigorous scientific validation of their actual diagnostic utility. This frequently led to tests being performed almost routinely, without a clear understanding of their real predictive power.
Just doing the tests, because that's what was taught.
Precisely. This approach, by contrast, establishes an incredibly stringent framework. Requiring tests to show appropriate diagnostic accuracy means they must reliably differentiate between the presence and absence of a specific condition with quantifiable levels of certainty. Being free from bias is critical. It ensures results aren't unduly influenced by external factors, the examiner's own preconceptions, or patient expectations, leading to more objective, trustworthy findings. And, most critically for you in clinical practice, being reproducible and effective for the condition and clinical environment at hand. Well, that means the test consistently gives similar results when performed repeatedly by different clinicians, and that it's genuinely useful and relevant within your specific clinical context for the conditions you're assessing. This ensures the test isn't just academically sound, but clinically robust.
So it has to work reliably in the real world.
Exactly. For you, the clinician, this fundamentally transforms your approach to special tests. You move decisively away from just rote memorization towards informed strategic selection. Instead of performing every test you ever learned for a particular joint, you can now select tests with real confidence, knowing they are backed by robust, validated evidence. This empowers you to perform fewer, more targeted tests, saving precious time, reducing unnecessary patient discomfort, and simultaneously significantly increasing your diagnostic yield. It means every test you perform has a clear purpose and a proven ability to meaningfully contribute to your diagnostic clarity, enhancing your precision and overall confidence in clinical decision making. It transforms testing from a mere checklist activity into a precise, evidence-driven inquiry, leading to more accurate and efficient pathways to diagnosis.
That level of scrutiny really is a game changer, fostering genuine precision. And to help clinicians navigate this evidence, a utility score is introduced to order tests from best to worst. There's even a dedicated user's guide for statistical terminology. What are the practical implications of having a utility score for clinicians on the ground? How does understanding key statistical concepts, even if implicitly through the score, enable more informed, nuanced decision-making, beyond just positive or negative?
The utility score is an incredibly practical and innovative tool. It effectively bridges that gap between complex biostatistics and immediate clinical application. In essence, it distills complex statistical data, things like sensitivity, specificity, likelihood ratios, which are the cornerstones of evaluating diagnostic tests, into an easily understandable, actionable ranking. For many clinicians, let's be honest, diving deep into the nuances of statistical methodology can be daunting and prohibitively time-consuming. The utility score does that heavy lifting for you. It provides an immediate, at-a-glance hierarchy of tests based on their proven diagnostic power.
So it simplifies complex stats.
It does. But understanding the practical implications of concepts like sensitivity and specificity, even if you're not calculating them yourself, is profoundly valuable. Sensitivity tells you how good a test is at correctly identifying people with the condition. A highly sensitive test, if it's negative, effectively helps you rule out the condition, SNNOT, as they say. Specificity tells you how good it is at correctly identifying people without the condition. A highly specific test, if positive, helps you rule in the condition, SPPIN. Likelihood ratios, which combine both, offer a more sophisticated understanding of how much a positive or negative result actually changes the probability of a condition being present for your specific patient.
Moving beyond just yes or no.
Exactly. By understanding these concepts, or simply by leveraging the distilled insights from the utility score, you can critically appraise and confidently apply diagnostic tests. You move beyond just performing a test to truly understanding what a positive or negative result means for your patient's probability of having a certain condition. This allows you to make far more informed decisions about further investigation, referral, or immediate intervention. Optimizing your diagnostic pathway, ensuring every clinical decision is grounded in the strongest available evidence. It empowers you to interpret results with greater nuance and precision, enhancing your diagnostic acumen significantly.
It truly empowers the clinician to be a critical thinker, right there at the bedside. And within this powerful framework, the material features focused chapters. Things like neurological and structural differentiation testing, special clinical tests of the hip, and special clinical tests of the lower leg, ankle, and foot. What's the distinct value of these targeted sections? How do they help pinpoint diagnoses for complex regional presentations? Could you maybe offer a real-world scenario where applying a test with a high utility score could significantly improve diagnostic clarity and actually change management?
Oh, the value of these targeted sections is immense, particularly when you're grappling with those often complex, overlapping presentations in specific anatomical regions. Conditions in areas like the hip or the lower leg and ankle, they can frequently mimic each other, can't they? Or they might have both distinct structural and subtle neurological components, making accurate differential diagnosis a real clinical challenge. These focus chapters help you systematically break down that complexity. They provide a precise guide through that diagnostic maze.
Helping you untangle things.
Precisely. Consider, for example, a patient presenting with diffuse radiating leg pain. Now, that could be indicative of a lumbar disc herniation causing sciatica, or it could be related to hamstring pathology, piriformis syndrome, maybe even deep gluteal syndrome affecting the sciatic nerve. Lots of possibilities. This is exactly where a chapter like neurological and structural differentiation testing, with its tests ordered by utility score, becomes invaluable. You might perform, say, a slump test, known for its high sensitivity and good utility for nerve root irritation. If this test, highlighted by the material for its strong diagnostic accuracy, is strongly positive and reproduces the patient's specific symptoms, well, it immediately steers your diagnostic pathway towards a neuropathic component, likely originating from the spine or proximal nerve entrapment. Conversely, if the slump test is clearly negative, it encourages you to focus your investigation more intently on local musculoskeletal structures, the hamstring origin, the piriformis muscle surrounding bursae.
So it really helps direct your focus efficiently.
Absolutely. A high utility score test, when applied correctly and interpreted within such a scenario, can significantly improve diagnostic clarity by either strongly ruling in or ruling out a specific pathology. This can potentially avoid unnecessary, costly imaging. It guides your treatment much more effectively right from the start and ultimately provides a more precise, efficient pathway to patient recovery. It's about not chasing shadows, but using validated tools to quickly and confidently identify the primary driver of the patient's symptoms, optimizing management and reducing patient anxiety along the way.
That's a fantastic, tangible example of how this translates to immediate, real-world impact, improving patient journeys. Now, reviewers specifically praise this approach for effectively doing all the work for you, statistically validating tests, saving busy clinicians from having to look up all the stats. Professor Imam, here's where it truly becomes compelling, I think. Could you comment on this crucial bridge between academic research and practical clinical needs? How does it empower professionals to, as they say, confirm with confidence a diagnosis and appropriate intervention strategy, as practitioners who use it daily have observed?
Yes. Here's where it truly gets compelling and, quite frankly, indispensable for the modern clinician. This material provides a vital, powerful bridge between the often, let's face it, abstract world of academic research and the demanding, time-crunched realities of daily clinical practice. Research consistently generates vast amounts of data, complex statistical analyses of diagnostic test performance, often published in highly specialized journals. For the average clinician, managing a full patient load, juggling admin, trying to stay abreast of advancements across the whole field, the time and, indeed, the specialized statistical expertise needed to delve into every single research paper for every single test. It's simply not feasible, nor is it necessarily desirable.
It's just too much.
It is. By rigorously performing that statistical validation, evaluating sensitivity, specificity, likelihood ratios, and then compiling it into an accessible ranked utility score, this material literally does all the work for you. It distills incredibly complex statistical analysis into immediate, actionable insights. This directly empowers you, the professional, to confirm with confidence a diagnosis and an appropriate intervention strategy. When a practitioner says they use it daily, it profoundly underscores how this resource removes the guesswork, removes that heavy statistical lifting. You're not relying on a hunch or a vague memory from a textbook or perhaps an outdated method. You are using a tool that tells you, based on robust, peer-reviewed evidence, the actual diagnostic power and clinical utility of a given test. This newfound confidence translates directly into more precise treatment plans, clearer patient communication, reduced diagnostic uncertainty, and ultimately, superior patient outcomes. It significantly accelerates the adoption of true evidence-based practice by making it utterly practical, immediate, and effortlessly usable in your busy clinical environment.
It's all about making that evidence truly actionable and accessible, isn't it? And finally on this section, reinforcing that practical utility, the format offers concise, quick resource material with step-by-step written instruction with pictures. How do these elements collectively contribute to the material being described as an indispensable text and a quick and comprehensive clinical resource for daily problem solving?
These elements are precisely what forge this material into that indispensable text, that quick and comprehensive clinical resource. In the rapid-fire, often high-pressure environment of a clinic, you simply don't have the luxury of time to wade through verbose academic explanations. Concise, quick resource material means you get to the core point immediately. Absorb the critical information, apply it without delay. It's built for efficient information transfer.
Speed and clarity.
Exactly, and the step-by-step written instruction with pictures, that is particularly powerful, foundational to its utility, I'd say. Visual learners benefit immensely from high-quality, full-color images. They clarify the exact execution of tests and procedures in a way text alone simply cannot. The combination of clear, sequential written instructions paired with illustrative pictures minimizes ambiguity. It ensures standardization in your technique. This is crucial not just for getting reliable, consistent test results yourself, but also for accurately reproducing the findings of the evidence-based studies that the utility scores are built upon. For daily problem solving, this intuitive format allows for rapid recall and confident application of knowledge. It means you can quickly verify a test you're about to perform, refresh your memory on a subtle nuance of an examination, or even confidently teach a colleague or student. It makes it a go-to reference for enhancing clinical efficiency, precision, and confidence right there at the point of patient care. It's essentially a meticulously organized, highly practical toolkit designed to support immediate, evidence-informed decision-making.
That brings us neatly to a powerful synthesis, really. We've explored the evolving landscape of orthopedic rehabilitation, the mastery of examination and diagnosis, and the precision offered by evidence-based testing. Professor Imam, these three pillars, while distinct, they're clearly profoundly interconnected. From your perspective, how do these elements, when you consider them holistically, create a truly more powerful, maybe even transformative approach to orthopedic care overall?
You've absolutely hit on the essence there. The true strength, the transformative power, lies squarely in their synergy, how they work together. A robust, evidence-based examination forms the bedrock. It allows you to generate a precise differential diagnosis, confirming the specific pathology or dysfunction with a high degree of confidence, precisely because you're using tests with validated utility scores, as we discussed. That accurate, nuanced diagnosis then directly informs and shapes the most effective, criteria-based rehabilitation protocols we talked about earlier.
So one flows directly into the next.
Precisely. Think of it as a continuous, iterative loop. The precise examination identifies the problem with unparalleled clarity. The integrated team approach plans the most comprehensive, tailored solution. And the criteria-based rehabilitation executes that plan effectively. And crucially, the patient's progress is continually monitored and reevaluated, often using those same evidence-based tests during reexamination. This cyclical, deeply integrated understanding is absolutely essential for achieving not just good, but truly superior patient outcomes. It elevates orthopedic care beyond just isolated interventions to a genuinely comprehensive, data-driven, and intensely patient-centric model. For you, the clinician, it's about not just doing things right, but consistently doing the right things at the right time for the right reasons, all grounded in robust evidence. It really moves your practice to an entirely new level of precision and effectiveness.
And the common thread running through all these discussions is clearly the imperative of evidence-based practice and a profound commitment to continuous learning in what is, as we said at the start, a rapidly evolving field. How does engaging with this type of detailed, expert-led discussion, rather than, say, just reading a summary, how does that specifically cultivate and sharpen critical thinking for professionals?
Well, engaging with this kind of detailed, expert-led discussion is paramount for cultivating true critical thinking, precisely because it goes far beyond just information dissemination. It actively prompts you not just to absorb facts, but to rigorously question them, to deeply connect different concepts, and to thoughtfully apply those insights. We've delved into the why behind the what, haven't we? Why criteria-based progression is biologically superior, why a single authorial voice can enhance clarity, why statistical validation is absolutely crucial for diagnostic reliability. This depth of exploration fundamentally deepens your understanding. It allows you to discern the nuances, appreciate the limitations, grasp the true clinical utility of different approaches.
It's more than just surface knowledge.
Much more. It's about moving from simply knowing how to perform a test to understanding when and why to perform it, and critically interpreting its specific implications for your patient's unique presentation. It constantly encourages you to consider alternative viewpoints, to rigorously weigh the evidence, and to understand, okay, what does this all mean for real-world application right there at the bedside? This iterative process, questioning assumptions, synthesizing diverse perspectives, evaluating the underlying evidence, connecting it back to the patient, that is the hallmark of true critical thinking, which isn't just beneficial, it's utterly indispensable in a field as dynamic and patient-impactful as orthopedics. It prepares you not just for today's known challenges, but for tomorrow's unforeseen complexities too.
Looking ahead then, Professor Imam, what are these advancements, these comprehensive integrated approaches, what do they signify for the future trajectory of orthopedic professionalism? And crucially, for patient care in the coming years?
I think these advancements signify a future for orthopedic professionalism that's increasingly defined by sophisticated specialization, profound integration, and truly uncompromising evidence-informed decision-making. The demand for professionals who can synthesize vast amounts of complex information, apply cutting-edge evidence rigorously, and work seamlessly, collaboratively within multidisciplinary teams, that demand will only grow. Exponentially, I suspect. It signifies a decisive move away from fragmented or siloed approaches, towards one where surgeons, physios, OTs, other allied health professionals truly function as a cohesive, high-performing unit, all with shared goals focused squarely on the patient.
A more unified approach.
Absolutely. For you, the clinician, a deep, integrated understanding of these pillars, advanced, criteria-based rehab, comprehensive, anatomically rooted examination, and validated evidence-based testing, it won't just dramatically enhance your individual clinical skill and diagnostic precision. It will also fundamentally contribute to a far more effective, efficient, and adaptable orthopedic ecosystem as a whole. It points towards a future where patient care is more personalized than ever before, where outcomes are more predictable, more consistently superior, and where the quality of life for individuals recovering from musculoskeletal conditions is profoundly improved. It's about a profession that continuously refines itself through rigorous inquiry and collaborative practice, constantly setting new, higher benchmarks for excellence right across the board.
So, bringing it back to the listener, what does all this mean for you? Whether you're grappling with a particularly challenging case right now, or perhaps seeking to refine your diagnostic approach to be more precise, or maybe simply expanding your foundational knowledge in orthopedics.
Well, it means empowerment, plain and simple. These insights hopefully provide you with those aha moments, those connections that translate directly into greater confidence, heightened precision, enhanced efficiency in your daily patient care. By embracing and deeply integrating these pillars we've discussed, you're not just staying current with best practices, you're actively shaping the very future of orthopedics in your own way. You're equipped to approach even the most complex patient presentations with a robust, evidence-backed framework, ensuring that every decision you make is grounded in the most effective, validated practices currently available. It really provides a strategic advantage in your practice, I believe.
So to quickly recap our deep dives today, we've underscored the absolute imperative of integrated team rehabilitation. We've highlighted the need for a systematic, comprehensive approach to orthopedic examination, and we've emphasized the non-negotiable role of evidence-based testing for true diagnostic precision. Ultimately, the message seems crystal clear. Mastering these fundamental areas, supported by a robust practical understanding, is absolutely paramount for delivering superior patient care in orthopedics today. If you found this deep dive valuable, please do consider rating and sharing it with colleagues who might also benefit from these insights. And as you reflect on today's discussion, perhaps consider this. How can a more deeply integrated understanding of rehabilitation, examination, and evidence-based testing, much like the comprehensive frameworks we've explored, how can that not only profoundly refine your own clinical skills, but fundamentally transform the patient journey in orthopedics? What one area, perhaps, will you choose to deepen your understanding of next? And how will that insight translate into genuinely improved patient outcomes in your practice?
Professor Moe Imam, thank you once again for your truly invaluable contributions today. It's been fascinating.
It was my pleasure. A truly insightful discussion indeed. Thank you.
And thank you for joining us on the Deep Dive. Until next time.